Welcome back to Simply Women's Health with CJ. So you've reached the ripe old age of 21 and your healthcare provider has recommended that you start having cervical screening tests, also known as the PAP test or the PAP smear. You're not really sure what to expect, you're a little bit nervous, and you've come to YouTube. Well, you've come to the right place, because today I'm going to explain what to expect when you go in for that first appointment. First things first, PAP smears are typically done in a clinic or an office setting. A lot of my patients believe that they had PAP smears done when they were seen in the emergency room. In the emergency room, they do use speculums to look in your vagina, but they are doing that to rule out any kind of infection. They usually get swabs while they're in there. They do not screen you for cervical cancer in either the emergency room or an urgent care center. That again is done by your healthcare provider. It can be done with your primary care provider. It can be done with a gynecologist, a nurse practitioner, a certified midwife, physician assistant. We're all trained in how to do PAP smears. So you make your appointment, you come in that day to be seen. They are going to prefer that you not be on your menstrual cycle. If you're having light bleeding, that probably isn't going to affect the results, but if you are bleeding heavily, they probably won't be able to get enough cells and it will come back with an unsatisfactory or insufficient result, and you'll have to repeat the PAP in 2 to 4 months. A little bit of light bleeding is fine. That can typically just be wiped out of the way and they can get the cells that they need. They are going to want you to take your breeches off. They're going to give you a drape to cover up, and they're going to have you sit up on a table. A lot of my patients are concerned because they didn't shave or they didn't wax. Honestly, most of us don't care. We are looking inside the vagina. We're not looking at the other parts. So you're laying on the table. You put your feet in the stirrups. You're going to scoot your booty on down towards the end of the bed. Your provider is going to take a speculum that looks like this. They're going to go into your vagina and they're going to look for your cervix. Now, most people's cervix is at the very back of your vagina and relatively easy to find. For some people, their cervix is deviated to the right, it's deviated to the left. For some patients, their cervix is more at the top of their vagina and a little bit harder to find. So if it takes a minute for your provider to find your cervix, please don't worry. It doesn't mean anything's wrong. It just means that your cervix is in a different place. Normal, but different. So they're going to put the speculum in. They're going to find your cervix. They're going to take a spatula that looks like this. They go into your vagina. They get cells off the top of your cervix. They put those in a cup. They're going to take a little endocervical brush, go up in, get cells out of the endocervical canal or the inside of the cervix and put those in a cup. Some people will use a slightly different instrument called a broom. I don't actually have a broom, but the broom is just one. They only go in one time and get cells and put those in the cup. After that's done, they're going to take the speculum out. When you have a PAP, most people feel nothing at all. It doesn't hurt at all. Some people will report a cramping sensation in their uterus. Some people even say that it feels pinchy when they have it done. Some people bleed after they have their PAPs done. If you are pregnant, you can absolutely have a PAP smear. Don't be surprised if you have a little bit of spotting or bleeding afterwards, because during pregnancy you have a lot of blood vessels in your cervix. Your baby is absolutely fine. It's just the very end of your cervix that is reacting to being brushed up against. Here's the thing. Nobody likes PAP smears. You're not supposed to like your PAP smear. I always tell my patients, if you like your PAP smear, honestly, that's kind of weird and I don't want to do yours. So if you are 21 years of age or older and you have not had your first PAP smear, today's the day. Hi, if you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.